I'm Rebecca Wilson. I'm a clinical psychologist, and I work with Dr. Tartaglia at the eXtraordinarY Kids Clinic in Denver. We've been seeing kids for the last few years, couple years, and I've been working with kids with developmental disabilities for about the last 15. I'm doing this talk mostly because a lot of parents ask me to do it. And so if you've already been to see us, I'm afraid some of this will be repetitive. I hope not too repetitive. But in the process of coming up with the things that I wanted to talk about, I found that there were a lot of things to talk about, probably more than I can do in an hour, certainly more than I can do in 50 minutes, but I'll take a stab at it here. What I tried to do is find some things that are common to all the kids we see with extra X's and extra Y's. So, there are a few things to talk about, but I think it's important, a few caveats here. First of all, at our clinic, we tend to see kids that are having troubles. So if these aren't concerns that your kids are having, don't be too concerned. We're seeing kids that really are coming because they have concerns. The other thing is, this isn't meant to be a research talk. I'm really hoping to mostly focus on practical ideas. Also, I chose things that are common to all kids with extra X's and extra Y's, so there may be some things that don't fit for your kid. The other issue is that I've left off some important ones. You guys are probably looking at this list going right now about 3 things that your kid has that isn't on this list. And those are conditions that I feel like have been covered extensively in other ways and perhaps better. And ADHD is a common one that, you know, there's already good treatments and interventions. So I tried to pick some ones that I thought we kind of have some special approaches to. So this is a big one. Does this look like a concern that a lot of people have for their kids? Mm-hmm. Yeah, okay. This is probably one of our #1 issues that we see in our clinic. So what makes school so hard for our kids with extra X's and extra Y's? I think the biggest issue is language-based learning difficulties, and I think it's really important to be clear that language-based issues are going to be a problem. And you're going to hear me say this over and over again, get back to the words, get back to language, because I think that's what makes things hard. And I think a lot of kids I see don't have trouble remembering. They have trouble remembering language-based material. If they can see it, if they can get their hands on it, if they can do something with it, they're probably going to remember it better than if it's language-based. And all of us want to be good parents, and good parents these days tend to talk to their kids. We're taught to explain things and talk about things, and that's probably the one thing that doesn't work well, and doesn't work well for teachers to do with kids. So, if your teacher is doing a lot of lecturing, a lot of sitting down and talking with your kid, you may want to talk with your teacher about that. Open-ended work, very difficult. If your kid's having trouble, see if it is because the work is too open-ended and if there's some ways we can structure it. The socially loaded environment of school is the other big factor. And I think it's part of what can be exhausting for kids. It's just too much language and too much social expectation. School environments are also very sensory loaded environments. You walk into a preschool and there's things hanging from the ceiling and the seats are hard and there's little tiny tables and lots of noise and lots of distractions and fluorescent lighting and da-da-da-da-da-da. So what you can do to modify the sensory environment of your child's school may make a big difference. Another issue that I see kind of gets overlooked a lot is that the written aspects of the school environment is oftentimes a real hurdle for kids. And a lot of times they're avoiding work because it's open-ended, it's language-based, and it involves handwriting. Those are the things that are the hardest. And so if we can modify, accommodate, and support those areas, I think school can be, you know, less toxic. And then challenges with stature. I think it's really important to look at how your kid is sitting in school. The desk is too low, the seats are too low, the you know, the sink is too low, that everything doesn't accommodate them well. We can't change the world, but maybe we can change their seating, or at least their desk. And that is appropriate to ask for. Yes?
I just wanted, maybe some of the parents would know, I picked this up here, the paper version of your presentation at the registration.
Yes.
No writing. It was at the
I should tell you, there are copies of it at the registration desk, and if there aren't, if we run out, leave your name and they'll make more copies.
Is there anyone that can maybe go get it?
Well, I thought maybe we'd talk today, and then you can pick one up at the end.
It's nice to be able to make notes with.
That's true. That's true. The printing process here is very, very laborious. It takes a long time for them to print them out. So what to do about school-based issues? Start your IEP process and start it early. Don't delay. It's just really important. I think it's really important to visit schools, or as you're transitioning, visit the next school your kid is going to. Get a sense of what the strengths and weaknesses are in your school, and who you can work with, and who you might want to avoid. Get a tutor or speech therapist or OT involved sooner rather than later. These are the folks that really can make a difference. And over the years, I've worked with kids with disabilities, and I did a study once that was a retrospective study of what helped kids with Fragile X, actually. And parents over and over again said, speech therapists, occupational therapists, that those were the guys that really were helpful, much more so than people like me, clinical psychologists. You know, and I know that insurance is an issue here. We were talking about that the earlier hour. It's a real big issue, and so I think you need to take what you can get under insurance and take what you can get from school, because school pays for it. Plan for transitions ahead of time. At every transition, I think our kids take more time to transition than other kids, and I think you need to be prepared ahead of time. So a year ahead, 2 years ahead, go to where the next school is, preschool, from the preschool to kindergarten. If you're going to transition schools from kindergarten to first grade, certainly from elementary school to middle school is a big one, and a big one middle school to high school. And let's not forget the big transition from high school to life. And those are important to start early. So, some ideas for your IEP. There's the words thing again. Do everything you can to reduce words, and you can write that right into the IEP. When you go to your IEP meeting, talk about, are there some ways we can reduce the language component of this program? And increase one-to-one support. I think most of the kids I see with X and Y really respond well to working closely with one person that they trust. Organizational strategies, I call this my office depot therapy. I really recommend a lot of my parents go once a week and clean out their kids' desk, clean out their kids' locker, clean out the backpack. I would like to say that our kids don't need it. I'd like to say my own kids don't need it, but they do. They need our help sometimes. And a lot of times you can get a sense of work that's missing, what is happening to that spelling list every week. I can't imagine. If you go through and help them organize on a regular basis, it really can help. Also, color coding things, using file things, yes?
You wouldn't recommend that for a high schooler?
No. For a high schooler, no. And I don't mean to do anything that's humiliating for your kid.
Right.
But, and it may be once a year that you're going through and cleaning out their locker, or in the middle of the year at the transition. So certainly you have to keep that in mind, but I think organizational issues are huge, and a lot of times our kids just don't have that piece, that organizational piece. Yes?
What do you do as a young adult when you're trying to get them to move on independently and they still don't have work?
And they still don't have it, right. I think, first of all, sometimes coaches help. There's vocational coaches that can play a role, so the parent can step out. And that's one of the reasons to get tutors involved earlier, because they will teach organizational strategies sometimes better than parents will. But I think a day timer or a Palm Pilot or something like that helps a good deal. Showing your kid, rather than telling your kid how to organize, and using simple strategies help. a good deal. Yes?
What do you think about professional organizers? Because I mean, I'm not organized myself. I have ADD, and I'm raising a son with Klinefelter syndrome, and
Yeah.
he's not organized either.
Yeah.
So the three of us are just one. Our house is a mess. It's like the Bermuda Triangle. Anything that goes in, we never find it.
You never find it again. Right. I think you prioritize what really needs to be organized and what, yeah, not that big a deal. Professional organizers are great, but they tend to come in, they organize. I mean, I love that idea. And then they leave again.
But some of them, I mean, aren't there some that are geared towards ADD? I mean, there's some that I think
Sure.
advertise
Absolutely.
helping people with ADD.
Yeah.
Would that be more like a coach or an organizer?
Yeah, a coach, yeah. And a little less, and an organizer, they tend to come in, and at least the ones I'm familiar with, they want to sell you a system. And I don't know that a system works if you don't have kind of the underlying organizational strategies in place.
Right.
Yes?
I recommend a coach, but where do you find this type of coach? And aren't coaches usually extremely expensive?
They can be, yes,
So
they
how do you
can.
deal with it if you don't have the money?
Well, the vocational coaches, if your child meets IEP criteria,
No.
no.
Well, in high school, yeah, but that was involved.
Well,
Fill it as psychologist, because that's what I've done with Ryan.
right, a lot of times transitioning from high school into vocational services, you can have a job coach involved. But if your kid is doing relatively well, he may not
Yeah, he's
qualify.
considered too high functioning.
Yeah, too high
So,
functioning.
but too low functioning for life.
Right,
What about the community college maybe?
that's a good idea, yeah.
For coach, maybe.
This is a big topic, organizational strategy.
Well, it's tangential in some respects, but it's related to the school environment. One of my colleagues works at helping school systems establish positive behavior support programs for kids in schools. And when they set up a PBS program, they basically spend a lot of time really studying what goes on in kids' lives. And what they're finding is, and this is just something for parents to be aware of, the school system itself, is that there's a lot of time in every school day where kids spend waiting, doing nothing, waiting for classes to start, waiting for activities to begin, waiting in lines. And this is where kids with special needs sort of get lost in having all that time. So one of the things they're trying to do is to get schools to be more cognizant of the fact that you cannot have all this sort of unstructured time necessarily. I don't know if that has any appeal to any, but I think that the more time kids are spending waiting, the more difficult it is then to get along to the next task, and the more difficulty they have socially, sometimes and interpersonally, depending on, again, the issues that
Right.
they deal with. And so it's good to go into schools and say, my kid needs this and this and this, but what's really important as well is to see what's happening in all the time that they're in school. And
Really
even in
looking at it,
classes,
yeah.
most typical classes, the teachers might be 6 or 7 minutes before the class starts, you know, and you don't realize that they're just sitting and waiting, and not all kids wait well.
And sometimes really having a hard time with that. The other thing is I don't know that organizational strategies in school always help with adulthood because they're different. They're very different tasks. So, but I think understanding what works in school for your kid and adapting that to adulthood is important. But the transition to adulthood is one of the big issues we see and we want to understand more about because adaptive skills in general are an area of deficit. Yeah.
What do you work on with children that are younger to start preparing them for school as far as that goes? Since that's
Right. Start early and spend more time and show more than.
like I'm pretty organized at home, like their toy
Right.
room, and trying to do that. I mean, does that?
So you start with let's sort the laundry together and let's start earlier rather than later, and then pick key areas. There may be some things that are less important and some things that you really see as most important, and safety, feeding yourself, and personal care are the areas that I think are really important, and social skills. I just want to emphasize building non-academic success. I think finding something that works for your kid and really doing it and really supporting that. Whenever your kid is going in, any kid is going into school having difficulty, you want to find areas that they don't have difficulty. Because let's face it, school's hard. I think it's hard for a lot of kids, and I think it's really important that they have an area that they feel good about. So let's not forget to involve our kids in this process. And there's some key things when you talk to kids that have been successful about what has made school successful for them. And I think as parents teaching our kids that there are some teachers that will help them navigate the system that they can go to. It may not be your child's primary teacher. It may be another teacher. It may be a paraprofessional. It may be somebody in the school that can help. And modeling working with teachers rather than against them. I would teach kids from a very early age to let us know when it's too many words and respect that. Try to slow down the language, use less words, and teach kids to say, can you show me instead of tell me? Can you tell me the first steps? Can you give me a list? Those are very reasonable things to ask of a teacher. A lot of times if you can start early getting into the IEP, other ways that your child can show that they know the information. Your kid may not be good at drawing, but your kid may be good at making collages, may be good at making very creative collages, and that can be powerful things, even if the teacher says, you know, I can't grade that. Once you begin teaching your teacher that my kid really does understand this work, and let me show you that he does. Asking for breaks, one of the things I do is recommend break tickets. So a kid gets a stack of break tickets and they can use them to take a break, get out of the class, get up and move around, run errands. Movie for books. This is a really important thing, I think, for kids with extra X's and extra Y's. Because they're visual learners, if they can see the story in a movie, it can really help them. And a lot of parents say, but that's not reading. Well, it's getting the overall concept, and if your kid gets to the point where they're arguing with you about that movie was different than the book, that's a good thing. They actually are analyzing what they've written, what they've read, and how it contrasts with the movie. The other thing is if your child is asking the teacher, is there a movie about this book? A lot of times what will happen is the teacher will think, as they're thinking through their curriculum, you know what, maybe I'll choose a book that has a movie. And this can be, even for much younger kids, Velveteen Rabbit, Bridge to Terabithia, all of those, you know, there's a lot of children's material that now has a movie version. And I'd encourage you to read the book as well, so you can talk with your kid how the movie is different than the book. The other thing you can do is talk with your kid about the themes in the movie, and that oftentimes helps. If your child is perhaps doing different reading material than the rest of the class, movies can be a good way for your child to be tracking what the rest of the kids are reading, so that they don't feel so left out. Presentations, oral presentations in particular, are usually difficult for kids, and teach your kid to self-advocate to not do oral presentations. Helping teachers with lessons are a great way for kids to learn, particularly in high school. This can really be a powerful way for kids to learn the material. And find a way to ask for help. Another thing that I see a lot is kids that have trouble speaking up, and language is a real issue for them. And they get quieter and quieter. You can just put a card on their desk with one colored size and one blank side or whatever, and have a child turn over the card when they need help. That way you're not putting the onus of them of raising their hand or walking up to the desk, doing something like that, so that the teacher just sees that your son or daughter needs help. Another big issue, reading and spelling. I could spend a whole nother hour on this topic, so I'm going to try to make it as quick as I can. And I want to give you some ideas as parents as to when to worry about reading and spelling issues. You should have an emerging reader by first grade and a reader by third grade. If your child is 6 months behind, begin to monitor it and watch it closely. Certainly dyslexia is very overrepresented in the kids we see, and I wouldn't hesitate to have your child appropriately and comprehensively assessed for dyslexia. They who do have dyslexia, and this is another big area of topic of conversation, what programs should you use? These are two that are commonly accepted and commonly used methods for teaching kids with dyslexia. Yes?
I just wanted to bring attention to there's a misconception that dyslexia just means reading things backwards.
Oh yes, thanks.
That is not just dyslexia.
That's not dyslexia. It's an associated symptom of dyslexia. It's actually not a symptom of dyslexia. Dyslexia is difficulty with phonemes, the underlying sound pieces of language. What we see a lot is kids with extra X's and extra Y's tend to be visual spellers. They're not phonetic spellers. And so teachers will tell you, oh, he's a great speller. But I don't know why he doesn't get this word. It's a perfectly easy word. It's because he's probably learned to spell the words he's seen a lot. And so a lot of times in evaluations, you'll get scattered results. And this is because if they happen to test the words your kid has seen a lot, I don't know, maybe it's in their video games, or maybe it's, it's somewhere that they've seen a lot, they'll be able to spell it. And there's some very difficult words that kids can sometimes spell because they've seen it. And so sometimes you'll get erroneously high spelling scores, or sometimes erroneously low spelling scores, because I think, and we think at our clinic, that our kids are visual spellers. So keep that in mind and use it. Always use their visual memory. So if visual memory is going to help them learn to spell, make this, especially the spelling words they're going to need to use a lot, repeatedly present those to them. And I think that doesn't mean kill and drill. I don't mean flashcards. I don't mean hitting your kid hard with this, because frankly, spelling is less of an issue now than it used to be because of spell checkers. Yeah?
I had a special ed teacher that was totally awesome with my son, and what she used that idea of visual memory and spelling to increase his sight vocabulary, and his reading is what.
Good. Yes. Yes.
So I thought that was great.
So there's a list called 100 most frequently used words. You guys should all have that list. That's a good list to keep, because those are the words that you want your kid to be able to spell and read and use.
Where do you get that list?
I'm a reading teacher, and I can email that to
Most
anybody.
100, yeah. Even if you Google most 100 frequently used words, it's a very common list. Get help for your kid as soon as there's a problem. Don't put it off. It's not going to hurt to get help earlier rather than later. I'm a big advocate of this. It's really important to keep it as fun as possible. Keep it light. Let's try to stay away from making school and reading and spelling so difficult. Using games can really help. Again, books on movie, books on tapes. Reading out loud, even into high school, can be great. It can be great fun. You can take turns. It can be a great family experience. And catch success when your kid comes home with half their spelling list correct. Let's talk about it as half correct. Don't forget. It's another big area, like I said before, handwriting and fine motor skills. A lot of parents aren't sure when to get help. As a preschooler, you should be seeing early drawing skills and snipping. Those are the early skills to be kind of monitoring between kindergarten and first grade. We should have kids learning to write. They're not writers in first grade. They're not legible yet. There's lots of reversals. There's reversals well into third grade. Don't get terribly upset about reversals. By second grade, your child should be writing. It's still work. It's still effort, but they should be progressing. Third grade is cursive, and I'm going to talk in a second about cursive versus printing. And in fourth to sixth grade, it shouldn't be war. When we see kids for our evaluations, and they're like, the first thing they want to know is, I'm going to have to write, because they don't want to do it. I know that handwriting is a big issue. And by high school, handwriting really should be functional, and it shouldn't be a big hindrance for adult life. What to do, be sure, is included in your IEP. OTs are usually the ones we work with. Now this issue of cursive versus print, for a while it was kind of popular to not teach cursive. But what I found, and I think a lot of teachers found, is that if you don't learn cursive, it's hard to read it. And so you need to have at least some exposure to cursive in order to learn how to read it, because there's so many variations in cursive. Our kids are good visually, so we want them to, we want to show them all the different cursive variations of R or Q, so that they can read it in just notes. But I think it's really important to move to a keyboard as soon as possible. Yes?
When I was in high school, about 4 years ago, the best thing they had was called Apple Smart.
Yes.
What was that?
Apple Smart.
Scroll that allows you to type.
Right, and exactly. Alpha Smarts are really, really great. Most school districts have them, even really small. It's called the Alpha Smart. It just is a keyboard with a single...
Four lines. It has a four-line scroll.
4 lines. You can see 4 lines?
4 lines with an LCD, which equals to be maybe 2 lines on Word.
Yeah, yeah. Those are really good in most schools. What?
The plug and print, you plug it in.
And then you plug it in and you print it out. Right, right. And I think that's a really good point. I'm glad you brought that up, because I think especially school districts that aren't working with you, this is a simple thing. Like I said, school districts have it, and if you can show to them that your child really can produce work with appropriate accommodations and support, a lot of times it gets the school up and working with you. But the other important thing about it is keyboards is where we're all going. I'm working on a keyboard right now. People are taking notes on keyboards. That's where we're going, so get those skills in early rather than later. And modifying written demands is really important. This is a good handwriting program. Most teachers are familiar with it, Handwriting Without Tears. There are a lot of them. It's just the one I happen to like. I am a big proponent of instant messaging, because those instant messaging will teach your kid keyboarding like you've never seen, especially if you get an interesting conversation going. Yeah?
Another thing, I totally agree with messaging because, or texting doesn't involve it, but...
Yeah, not texting, that's a dumb thing.
Unless it's a BlackBerry with a full keyboard.
Right, but then still you're not doing it.
Instant messaging helps the kid speak.
It does.
Because especially if you word something wrong and by accident insult a friend, you have to type that or else you might miss it.
Right, right. It's very important to keep in mind. You know, okay, so obviously, monitor, your kid should be talking with the right people, but if you can get a teacher to instant message your kid, it can be a great way for a teacher to teach stuff. It also can be a very fast way that your child can ask questions of your teacher without having to speak up. And I don't mean necessarily in the schoolroom, but I mean like when we're doing homework. Facebooking also, another big issue, obviously monitored. You obviously want to ask to be a friend on their Facebook, but another great way to learn typing skills without your kid knowing it. But a good typing software is Typing Instructor for Kids. That's a pretty good one. Okay, nobody's ever had a homework battle. Right? No. Never been a problem. This is another big issue we see in our clinic, and I'm not going to say that I can solve your homework battles. Got my own at home. But let's keep in mind one really important thing. There's only so much gas in that homework tank, and let's use it appropriately. Sometimes I recommend take how long it takes your kid to do homework, even if that's a crazy amount of time. The absolute max amount of time to do homework or do any written work for adults, and reduce it by half. Expect that. Then if you have like a high schooler or somebody that actually really has to get their homework done, do it in increments. So do 2 if you know your kid can't do any more than an hour of homework. Cut it by half, do half an hour, give him or her a break, and then go back to it. But I really, really think it's important to ask for accommodations around homework. The cycle I see a lot is teachers are like, well, they're not getting their work done in school, so I'll send home homework, And then the homework gets bigger and the battles get bigger, and then the kid doesn't bring back their work, and so then the teacher adds more work. You know what? That's
Like
crazy.
it's working, yeah.
Yeah, it's way too much working. Kids need breaks. Kids with extra X's and extra Y's need more breaks than the rest of us. It's crazy to make home as hard as school. And I really, take that to your IEP. Talk to the teacher. Instant messaging can be a great way. I have some teachers now that are texting, are permitting texting, so that you can just text your teacher, do we really have to do 12 spelling words tonight? And nobody has to make a phone call, nobody's getting interrupted, and the teacher will text back, yeah, do 5, or do these, or I think these are important. And also it teaches your child to advocate for themselves, because your child may feel very comfortable texting their teacher, whereas not so comfortable calling them. See if you can complete homework at school. I really like this idea. I like home to be a place of escape. It is for me. I want it to be for my kid too. So especially in elementary school, a lot of times teachers will allow homework to be done at school. And in those periods that are downtime at school, especially if your child has social concerns, they may want to spend some of that time doing homework, but I certainly don't want them to spend all of that time, because it's an important time for them to learn social skills. Homework camp. I'm not going to go into details about this, but here's the thing. I think what happens is we lock horns with our kids around homework. And I would suggest talking to them about this. Look, I don't like this, you don't like this, what can we change? So, we can change a lot. The idea is to sit down with your kid and ask them, what will work? I know you don't want to do your homework. I wish you didn't have to do your homework. What will work to help you to get your homework done? These are some sensory ideas. Sensory.comfort has some great, like, weighted blankets, all kinds of stuff. Snacks, we have sour, crunchy snacks, these kinds of things can help. I think the idea is to break up the stereotype of homework happens at a desk, sitting there, like Leave It to Beaver. I mean, it doesn't. And so finding a way that homework will work for your kid, I think, can help with the homework battle. And then as parents, I think if we can provide structure for their homework, a lot of times that really helps. So you guys are probably already doing this. Your kid has a big old essay, homework assignment, and you have to turn it in. Is there some way you could make it more structured? Okay, this is another issue we see and we'd really like to understand more about. And we know that for some kids, testosterone may play a role in this, but I'm seeing it across our whole population and across ages. And I think it's really important not to just assume your kid's being lazy, because we see it enough that I'm concerned about it. So one of the things I ask parents to do is are some of your meltdowns and tantrums in the afternoon? Is that where your irritability really peaks? Do you have good mornings? Things seem to start out good, and then in the afternoon things kind of go downhill. Is your child having trouble waking up in the morning? Is afternoon irritability an issue? And just in general, more afternoon problems. If so, first of all, I would be sure to talk with your doc about it and rule out some things like medication issues, if there's sleep apnea, those kinds of things. But try an afternoon nap, and this has been really helpful to a number of patients I've worked with, even high schoolers. And we have some kids that are taking naps at school right after lunch, and it really has helped. For high schoolers, they come home, they take a nap, and then they get on. It's really been helpful. If it's not a full-on nap, at least rest. I think what happens a lot, and it happens for a lot of kids, is they come home and they watch TV and they play video games. And that's not a rest. And then they're kind of going into their evening and into homework and after-school activities exhausted. And I have been surprised how many kids I've talked to about an afternoon nap, and they're like, yes, it's great, and they really like it. But certainly you want to rule out sleep disorders, sleep apnea, consider whether it's a medication or a medication reaction of some kind. But the other things you can do for in-school fatigue and time when your kid needs to be up and going is look at their seating, see if they sit up straighter. If you change their seating accommodations, will they do better? And get exercise. Okay, so how many people like to exercise? Either you do or you don't, and a lot of teenagers really don't like to exercise. So I really recommend trying to find exercise routines that your child doesn't necessarily know that they're exercising. Obviously, it's great if your kid's involved in some sport, but if they're not involved in a sport, consider just kind of more practical ways to just get any activity at all. And the two things that stick out, well, three things. The Wii. Now, it's not great physical activity, but it's better than video games and TV. And it's a start. But biking and swimming are two areas, I think, because muscle is better supported. A lot of our boys with XXY in particular have done very well in cycling and swimming and really enjoy it. And do it together. Oh yeah, that part. Daydreaming is another thing. I think probably we're seeing a lot of the afternoon fatigue issues with daydreaming. When to worry, it's important to rule out whether something else is going on. If your child is staring and you can't disrupt them, you need to see a doc and tell them about it. Log it, time it, and tell them about it. They look as if something frightening is happening that really isn't happening. Your child describes day nightmares. You say to them, wow, what's going on? And they say, I was having a nightmare. I really have that evaluated. If daydreaming forms a significant part of their day, I'd be very concerned, and I would want a full evaluation if that's the case. If they seem sleepy afterward or seem very depressed after an episode of daydreaming. And a lot of kids use that word, I feel empty, and that oftentimes is associated with depression or more difficult problems. So if your child is complaining of those things. If they're daydreaming instead of doing something you know they like to do, I would be more concerned. So these are the kinds of things that may be going on with daydreaming. Monitor it and identify things that may be associated with daydreaming. A lot of times I hear teachers say, your kid is daydreaming all the time. Well, that's oftentimes not the case. Oftentimes, once you can really get that logged more accurately, you can identify what's really going on. Is it their high-carb lunch? Is it because, and this happened recently to a patient I was seeing, the teacher was complaining of lots of daydreaming. When we really looked at it, what was happening was that the child was daydreaming during language-based discussion groups. And it really wasn't working for him at all. Okay, so everybody needs to daydream some. Don't take it all away. But you can, again, use break tickets. Sometimes I call them dream tickets. And these are tickets that a kid might use to go take a walk and get some of that daydreaming out. I think kids need to escape, especially from highly language-based activities. But using daydreaming as a gauge is very helpful. Doodling has recently been found the #1 best anti-daydreaming cure. We all do it. Some of you may be doodling right now. It's a great way to keep our central nervous system engaged while we're listening to particularly auditory information. There's a number of yoga techniques that can really help kind of refocus kids and get them back on task. I don't know how many of your kids use tape boxes. But it's the idea, especially in elementary school, but also in high school, of determining an area that a child can get up and pace around. A lot of teachers will say, I can't have your kid wandering around the class now. But if you say, okay, can we tape off a box? Can we tape off an area for younger kids or identify an area for older kids that a child can get up, walk around, and move around? Medication can definitely help with daydreaming. It really, particularly for kids who have kind of a more inattentive style of ADHD, medication can help get them on board. Don't punish daydreaming, and don't allow teachers to punish daydreaming. It really is an important way for kids to escape. I would just try to limit it, give your child some time to take a break, and then get back to work. I know none of you guys have ever dealt with this either. This is another big issue we see in our clinic. And I would be very concerned if tantrums are becoming aggressive and destructive, or a child's really losing touch with reality. And I don't just mean that they're really mad. I mean they're really talking as if something's happening that isn't happening. I would track the duration of the meltdown and the frequency of the meltdown and the intensity of the meltdown. And the reason for that is that I really think we need to understand what's triggering meltdowns. Thinking triggers is important. So, tantrums are for a reason. Really, they are. So the ABCs of a tantrum are what happens before the meltdown, that's the A, what's the actual behavior, and what's the consequence. If you can begin to track those things, you can begin to understand your child's tantrums a little bit better. I think sensory issues oftentimes trigger meltdowns for kids with X and Y, and I think it's important to understand which are the triggers, not just vaguely sensory. And I know you guys are already doing this. Oh, he's hungry. Feed him, quick. Feed him. And so but you do want to be aware of these so that you can pass those triggers on to other people also. Because you as a parent may know very well what the triggers are, but it's important to know for other people. I really think language is a big trigger for meltdowns. And for kids that I see, when I can feel that they are getting agitated, I naturally slow my language down, quiet my voice down, and use less words. And they tend to respond well to that. I think fatigue and frustration is oftentimes an issue. So you want to anticipate the kinds of things that are likely to create meltdowns and redirect them if you can. Habit reversal is the idea that we all have habits. And if you can reverse the habit, you oftentimes can reverse the tantrum. So for, I'm thinking of like little kids that have a head banging kind of tantrum. A lot of times if you can disrupt it before they start head banging, you can disrupt the tantrum. Not always, but you can sometimes reduce it. The other thing that I think is really helpful is to give the tantrum a name, some way that you can be talking with your kid in simple terms about how they're feeling. So I think a tornado's coming on, kind of feels like things are getting a little stormy. Some term like that that's a good buzzword so that your child can learn to mediate and modulate their own sensory emotional experience, and so that they can communicate with you as you're standing there talking to a friend and they're standing there next to you like, I'm really going crazy here. He can say to you, Mom, storm's coming, or Mom, I'm about to go down the rabbit hole. Whatever it is that works is really helpful. It oftentimes can help cue your child that, okay, I need to try to hold it together here. I need my squishy toy, or I need my weighted blanket, or I need my hoodie, whatever it is they need to help them modulate the sensory environment. But it can also let you know in a way that's not humiliating for your child that you need to change the situation. It's very important to model coping and calmness, and it's hard to do when you're in a full-on tantrum, but it's an important piece to keep in mind. It is difficult to have a tantrum and be laughing at the same time. Humor tends to use a different part of the brain than anger and meltdown uses. So if you can engage humor, your own humor, or ideally your child's humor, you oftentimes can head off a meltdown. Shorten and extinguish shorten rather than extinguish. I don't think we can have the expectation that our kids with a whole bunch of difficulties are going to be able to extinguish their tantrums, but at least if we shorten it, I would see it as a success. Once you're in a meltdown, stay calm, try to reduce that language, and try to use redirection rather than saying more, doing more, intervening more. Try to slow down, back off, give space. CPS, you guys are probably familiar with CPS. It's a pretty helpful approach. Dr. Green has done a pretty nice job with a collaborative approach to preventing tantrums. And then getting a therapist involved. I'm at number 8 and I have 12 to go, so I'm trying faster and faster and less and less words. Another huge issue is anxiety. We think it's way overrepresented in our group. By the way, remember, I'm talking again tomorrow, so we can go at it again then. A lot of parents aren't sure what anxiety looks like in children. And these are the basic issues that come up, and they can oftentimes, especially in children that are not verbal yet, it can be hard to know whether they're worrying. But I think it's helpful to begin tracking concerns about anxiety, especially in our kids, and especially when your kid is young, so that you can begin to intervene earlier rather than later. For younger kids, they tend to be more behavioral. There's less talking about and worried about things, but they look more agitated, more fretful. You see sometimes picking behaviors and nervous habits. Separation issues are oftentimes highly associated with anxiety later on in childhood. Stomach aches, headaches, those kinds of somatic concerns. And in older kids, we see more rumination, more kind of internal worrying, and more what we call classic anxiety, classic phobias. More obsessive compulsive disorder and more medical problems come up. Certainly, in adults we would see ulcers and heart disease and those kinds of things associated with anxiety. Not necessarily X and Y's. So, this is the basic old approach, not old actually, it's relatively old, but the idea for anxiety is what I call KEC, or KEC-IT, contain, externalize, and compete. So, you've got a kid who's got anxiety, you want to try to contain the anxiety in some way that feels reasonable. Find a time and a place for it. So, these are ideas like, you have some worry time after school today. Let's talk about all your worries at the end of school today. Right now, we're getting you ready for school. We're going to do worry time later. Externalize, give it a name, like worry time, and try to institute ideas like competing demands, which is to relax and redirect. It's hard to relax and feel anxious at the same time. This is important for us to remember. Usually, if you're around somebody who's anxious, you'll get anxious yourself. So if you can contain your own anxiety around your child, it will help them be less anxious. And then manage what you can. This idea of worry time and worry box is in Dawn Hubner. She's got some nice practical approaches for kids with worries and anxiety. So, manage what you can about anxiety, except that your kid may just be kind of anxiously wired. But the idea would be to take their worry and give them a time and a place and a way to feel anxious or feel perfectionistic about something, but then let it go for the rest of the time. The idea would be for your child to have a simple way to talk about it. Again, depression, I think, is hard for a lot of parents to know what it looks like in kids. These are the basic clinical indicators for depression. In younger kids, it tends to look more like irritability and inattentiveness. And in older kids, it tends to look more behavioral. And I certainly, if your child has depression, I encourage you to get treatment and get intervention. And for depression, I like to kind of think of identify and build as two basic concepts. Try to identify the basic concern and build coping skills. There's a lot that I can talk about here too. I could spend a whole hour talking about depression and anxiety, mood disorders in general. And I know that now we're putting the next talk off to be late. but trying to use resources to identify depression, so your kid's talking about what's bothering them, and then to cope with it appropriately. Okay, so here, let me ask you guys, would you rather talk about OCD and perseveration, or would you rather talk about what to do when things get really tough, kind of planning for the hardest stuff? Planning? 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 Okay.
All of this is on that sheet, you should be able to get them.
Yeah, absolutely. Oh, and I forgot, social skills. Let's not forget social skills, sorry.
How about we do part B tomorrow?
Yeah, why don't we do that? And I just don't want to interfere with what you guys also have. We kind of got started late, and so.
Well, we have a 15-minute break.
Do we have a break right now?
Yeah, at 11 o'clock to 11:15 is a break. So we have a 15-minute break.
Well, I also want to give you a chance to ask questions. So here's the basic idea. Let's talk a little bit about kind of what to do when things get really tough. I really think one of the things we talk a lot about in Denver is that these kids are dealing with a lot. And I think it's important for you as parents and for educators and other people involved to understand just how tough it really is. We have children that have language-based learning difficulties, mood disorders, social skills deficits. Oftentimes, kids with extra X's and extra Y's have different thinking than other people. They have executive functioning deficits, stature differences, and it's all too much. So, I think first of all, we see a lot of kids with very significant psychological distress and really overall difficulty with functioning. And sometimes intensive services are necessary. And what I talk about is a continuum of care. Continuum of care is the idea that I think we all need to understand that there's a level of that when your kid just needs typical supports and typical interventions. And then there's the next level up, which is day treatment, more intensive therapy, short-term school-based day treatment, or longer-term school-based treatment, community-based day treatment, accessing community mental health centers, accessing day treatment programs. And I think before your kid has trouble, finding out what's available in your community is important. The issue here is planning ahead of time so that you can talk with the providers about what your kid needs. Most mental health services are very language-based, and that's very counterproductive. So activity-based, more visually based programs can be really helpful. So looking for day treatment or inpatient settings that provide less language or are willing to adapt less language and willing to adapt more activity-based programming is important. But what I'd like to say is, I think parents see this as the worst thing. Hospitalization, day treatment is the worst thing. I actually think it can be a very powerful and positive experience for everybody. I think kids need to feel like it's going to stop. Like if things get too bad, it will stop. And I think parents need to feel that also. So I certainly would encourage you to research what's available in your area in terms of the continuum of care, so that you know what the next step would be and you know the people involved, you know whether your insurance is going to cover it or not, or what it would take for insurance to cover it, and who are the key players and who might know about X and Y, but more importantly, who might be sensitive to X and Y concerns. At our hospital, we have a good inpatient program, we have a good day treatment program, but we also have an intensive neuropsychiatric care center which works with kids with autism. That's not necessarily a great place for kids with extra X's and extra Y's, but at least they can consult with the other units. So I'm going to stop. I do not want to forget to leave this out. Using your kids' strengths to work with them in a practical way is really important. So thanks. You guys have questions? Yes.
I'm just curious, do they have any knowledge or research on why, like XXY, why it affects them all these ways? In other words, if it's just a hormone imbalance, and then there's testosterone at one point, why do they still have all of that? What is it that actually has that affects them?
Right.
They know.
Good question. The question is, why are we having these problems? Why is an extra X associated with these problems? That's what we'd like to know.
They have no idea.
Well, I think so. That's what we're working on. And so I don't think we know. I think we're trying to
Because I
understand
originally
that.
thought once he was given testosterone, he was changed.
Everything would change, right? It'd all be better. But not, right? But some things change. Yeah. Yes?
How often are children also diagnosed with autism?
Very often. Well, very often. Overrepresented, more than we would expect. In our experience, we are seeing kids that meet criteria for autism, but in a different way than typical kids do. When I'm not doing X and Y, I do autism. And so I see a lot of kids with autism, in Denver. And I think that kids with extra X's and extra Y's sometimes look just like a child with autism, but more often than not, they're atypical for autism and more like PDD. And I think
More like what?
more like pervasive developmental disorder, PDD, like a mild or mixed autism. Most of the kids I know want to have friends and are uniquely friendly. They're just uniquely friendly. And so we want to understand more about that, but it's not classic autism most of the time.
Is it more like Asperger's?
Sometimes it's more like Asperger's, but Asperger's is when there are language strengths.
Oh.
So that really doesn't fit our kids. I think it's more like is you have some of the social skills deficits and the restricted interests of kids with autism, but not the underlying pervasive social deficits that we see in real autism.
Yeah, because they want to communicate, they just don't know how.
Right.
They don't do it appropriately.
Right. And that's more like Asperger's. But Asperger's diagnostically has to be language strength.
It's called persuasive what?
Pervasive developmental disorder, NOS, PDD, PDD, NOS.
Isn't some of their social issues because of language barriers?
Yeah.
I mean,
I think so.
I can see that with my son, who's 2, he doesn't talk, he gets
I think
frustrated.
so. I also think what happens when you have an early onset of language-based learning difficulties, which a lot of our social skills are language, that tends to have downstream effects to social skills that may not be the same neurological issues that we have with autism. May not be. So absolutely, I agree with you. I think it's language. And anxiety and mood.
That's what I want to
Sensory.
ask. Right now, he's not doing meltdowns.
Right.
He's too much.
So one of the things I didn't get to talk about is I really, really think speech therapists should be doing sign language, simple social sign, so that kids can early on learn stop, all done, more.
So I'm sure you're aware that most of the kids, they're not kids who've been diagnosed, they're adults. And this lecture is primarily for kids.
Yes.
Could you possibly, maybe the next time you lecture, also bring in the young adult to go over? Because the finding jobs, how to interview, how it's all language based, reading manuals.
Right, and I think that was the other thing that, we really talked about is should we do the adults? It's really hard to do it all, but you're right, we need to have a separate.
It's like, what if they have to be independent and they're grown fast?
Yeah.
What in the world, that transition area is nowhere. When he graduated high school, he was given no information. And I've had to find everything out on my own, and most of the time it was recruited to mental health clinics to drug.
Yeah.
And he doesn't want to take medication. So, you know, it's like, thank goodness he's not severe, but I'll tell you, good luck interviewing, because it's language-based.
Language
What are you supposed to tell you about the person that's interviewing? Oh, by the way, I have all these problems, will you please hire me?
Right. Not.
So what are they going to do, how are they going to do their job with members of society?
Yeah.
Anyway, I think possibly in talking to you through
You
the
bet.
record, that's an area that's really.
And it's something we'll think about over the next year. And you're right. I mean, mostly in our clinic, we're seeing kids.
They're staying at home, they're not leaving. And how do we get them to leave? They have to
Yeah.
get this adult skill.
Right. And I think we don't know a lot about that yet. I don't think we know a lot about that in the developmental community in general, because we really base that more on kids with intellectual deficits.
Yeah, we have a lot of these